Hi guys, welcome back to this channel. My name is Ashish and I'm a junior doctor working in the UK. Today's video is going to be about core surgical training applications and how you should make your portfolio and structure it so that you can get into core surgical training easily. I'll be talking about all of the application process and how you can apply for the training, and I'll be talking about the self-scoring criteria which has been introduced in 2021. Before beginning this video, I want to say that if you support my work on YouTube, you can do so by clicking on the like button. You can share this video with your friends and you can subscribe to this channel to support me. So let's start. Core surgical training applications open up at the start of November every year. So by this time, you must have completed all your PLAB exams and you must be registered with the GMC to be practicing as a doctor in the UK. And you must be working at a non-training post or at a training post, which is a foundation year training post. So in the first scenario, when you're working at a non-training post, you should have a CREST form signed, and this form can be signed by any of the consultant whom you have worked with for the past 3 months. And this form says that you have the same competencies as a foundation year 2 doctor in the UK who has trained here. Now, in the second scenario, when you're working at an official foundation doctor post, you do not need this CREST form and you can apply for the surgical training directly. So you need to go to Oriel and you need to fill in the form there. Once you go to Oriel, you'll find a really big form there which will ask you to include all your details, including your personal details, demographic details, your employment history, and a lot of other things. And it will ask you to upload your CREST form there if you're working at a non-training post. And it will ask you to upload your ALS certificate there. Now in 2021, because of the COVID pandemic, a self-assessment scoring criteria has been introduced and all candidates will be required to complete this score, and this is based on your own achievements in various domains at the time of application, and this is a mandatory thing to do and you will not be able to submit your applications without completing this. Once you have completed your application and submitted it, you will be part of the evidence verification process, and at this stage only 1100 trainees can be accommodated. So the self-assessment score will be used to shortlist if more than 1100 eligible applications are received. And the verified evidence score is then used to determine whether you will be called in for an interview or not. So this is the whole shortlisting process. Some important points to note here are that there is no set number of years within which you need to have completed the achievements which you have listed here. However, any achievements claimed must have been gained after commencing your medical or the first undergraduate degree. That is, achievements from school or before the university cannot be claimed. The second important point to note is that if you have more than one achievement within a single domain, then you should only claim points for whichever single achievement would give you the highest score. The third one is that all achievements should be completed at the time of applications. So this will not include the courses which you are currently enrolled in, and these have to be completed at a future date, or the publications which are in the process of review. Let's talk about the self-assessment criteria in more detail now. So all the individual scores from the self-assessment criteria will be added to arrive at the final score for your application, and this final score will decide whether you are called for an interview or not. Let's talk about what all is included in the criteria. The first one is Mrcs Examination. So you can see in the table that there is different scoring for different options which can be possible. So the first option is that if you have sat and passed the Mrcs Part A examination, then you'll be scoring the highest, which is 3 in this domain. If you have sat and failed the Mrcs Part A examination, or if you have already booked to sit in the exam in the future, then you'll be given 1 point. But you haven't sat or have not booked an Mrcs Part A examination, then you'll be scoring 0 in this. The next one is surgical courses. Now you can see that I've mentioned 15 surgical courses here, and these are the courses which have been approved to put in to be scored in this domain. So you can pause this video here and have a look through all of the 15 courses, and you can search for these courses on Google's for the available date, because a lot of times there is a huge waiting list for these courses. So try to complete a few of these surgical courses so that you can be scored. So the scoring criteria for the courses is as follows. So if you have attended 2 or more surgical courses, then you will be scoring the highest, which is 4 points. If you've attended a single surgical course, then you'll be given 2 points. And if you have not attended any surgical course in the previous list, then you'll be given 0 points. The next one is surgical experience. Now, all the surgical experience should be evidenced by ISCP operative logbook summary sheets, which have been signed by a consultant showing their name, their GMC number, and the date the consultant validated the summary sheet. Keep in mind that you cannot include the procedures that all UK trainees are expected to have signed off as part of their foundation competencies. So in the surgical experience, if you have been involved in more than 15 cases, then you get the highest points, which is 3. If you are involved in 11 to 14 cases, then you get 2 points. If you are involved in 5 to 10 cases, then you get 1 point. And if there is no evidence, or if you have been involved in less than 5 cases, then you get 0 points. Next one is surgical taster days. So 1 to 5 working days of surgical taster sessions is acceptable. Now, what do surgical taster days mean? So while you're working as a doctor in the NHS, or if you are not working here but you are a medical student, you can go for these taster days, and these are like clinical electives. And if you have shadowed any of the doctors in a surgical department, then these count as surgical days, and you need to provide a reflection explaining what your taster days involved and what your learning from it was. And you need to get it signed from the consultant under whom you went for the surgical taster days. So the table here shows how you're scored for your surgical taster days. So if you have attended 4 to 5 days of surgical taster session, then you'll be given 3 points. If you have attended 1 to 3 days of surgical taster sessions, you get 1 point. And if you have not attended, or you have attended less than 1 day of surgical taster, then you get 0 points. Next one is a surgical elective. Now this is for a much more longer duration, and you will need to provide a reflection which is in about 200 to 250 words, including the elective dates, the hospital where you went to, the name of your supervisor, and an outline of what the elective involved and what kind of learning you have had from it. So the scoring of the surgical elective is as follows. So if you have undertaken an elective in a surgical specialty, then you get the highest points, which is 3 points. And if you have not taken any elective in a surgical specialty, then you get 0 points. The next domain is your qualifications. So if you have a PhD or MD by additional research, you get the highest score, which is a score of 4. If you have a bachelor degree in addition to your primary medical qualification and you have first class honors or equivalent, you get a score of 4 again. If you have a degree obtained during your medical course, which is intercalation, BSc, BA, and you have first class honors or equivalent, then you get 3 score. And if you have had a taught and research master degree, then you get a score of 3 as well. If you have a single year postgraduate course such as MSc, MA, or Mrcs, then you get a score of 2. If you have Master of Philosophy, you again get a score of 2. If you have any degree obtained during your medical course, which is intercalation, BSc, or BA, in which you haven't received the first class honors, which is scoring an overall score of more than 70%, and it's 2.1 or equivalent, which is second class honors in the upper divisions, which is usually more than 60% of the overall score, then you get a score of 2. And if you have a degree obtained prior to starting medicine with again 2.1 or equivalent, which is the second class honors in the upper division, then you get a score of 2. Any other degrees or qualifications in addition to your primary medical qualification which is not covered in the above categories give you a score of 1. And if you have your primary medical qualification only and haven't done any other degrees, then you get a score of 0. The next domain is about the prizes or awards which you have received. So if you have been awarded a national prize related to medicine, you get a score of 8. If you have a high achievement award for primary medical qualification, which is honors or distinction, which is awarded to no more than the top 15% of all the students, then you get a score of 6. If you have received more than one prize related to parts of your medical course or foundation program, which is awarded to no more than the top 20%, you get a score of 4. If you have been awarded a regional prize related to medicine, you get a score of 4. If you get one prize which is related to the parts of your medical course or foundation training and it is not awarded to more than the top 20%, then you get a score of 3. If you have been awarded a local prize related to medicine, you get a score of 2. If you have a scholarship or equivalent which is awarded during medical undergraduate training or foundation years, then you get a score of 2. And if you have none of the prizes, you get a score of 0. Next domain is a very important one and it gives you a very high score. So this is about quality improvement projects or audits. So if you have played a leading role in design and implementation of a sustainable change, which is completing more than one audit cycle using a quality improvement methodology or clinical audit, and you have presented the complete results at a regional or national meeting, you get a score of 11. In the next category, if you have played a leading role in completing more than one cycle of the audit and you have presented it at a local meeting, then you get a score of 9. And if you have played a leading role in the audit and you have not presented the results, then you get a score of 8. Now, if you have not played the leading role but you have actively participated in the complete audit and you have presented this at the meeting, and this can be any meeting, you get a score of 6. If you have played an active role but you have not presented the complete results at a meeting, you get a score of 4. And if you have participated in only certain stages of a QIP or clinical audit, which has completed at least one cycle, then you get a score of 2. And if you have not done any of these, you get a score of 0. Next one is your teaching experience. So if you have worked with local tutors to design and organize a teaching program to teach healthcare professionals or medical students, and you have done it for a period of 3 months or longer, and you have evidence of formal feedback, you will be scoring 8 or 6. Now, the score depends on whether you have done this at regional level, and this will give you a score of 8. And if you have done this at a local level in your hospital, then this will be a score of 6. If you have provided regular teaching for healthcare professionals or medical students over a period of approximately 3 months or longer, and you have evidence of formal feedback, but you didn't sit with the local tutors and organize whole of the program, then you get a score of 4. If you have taught medical students or any other healthcare professionals occasionally and you have evidence of formal feedback for this, you get a score of 2. If you have taught medical students or other healthcare professionals occasionally but you don't have any formal feedback, you get a score of 1. And if you have none of these, you get a score of 0. The next domain is training and teaching. So you'll score the highest points, which is a score of 4, if you have a master's level degree or a higher qualification in teaching, such as a PG Cert or PG Diploma in teaching. If you have a training experience which lasted for 5 days or more and less than 20 days, then you get a score of 3. And if you are undertaking a course for a higher education in teaching, such as a MSc or PG Cert, and you can provide the evidence, then you get a score of 3. If you have had brief training in teaching methods lasting no more than 2 days, then you get a score of 2. And if you have had brief training in teaching via online modules and you can provide evidence of this, you get a score of 1. And if you have had no training in teaching, you get a score of 0. Next one includes your research presentations. So if you have given an oral presentation at a national or international meeting, you get a score of 6. If you have shown more than one poster at national or international medical meetings, you get a score of 5. If you have shown just one poster at national or international medical meetings, you get a score of 4. Now, if you have given an oral presentation, but this was at a regional medical meeting, you will get a score of 4. And if you have shown more than one posters at a regional medical meeting, you get a score of 2. And the last one is that if you have given an oral presentation, or you have shown one or more posters at a local meeting, you get a score of 2. And if you have not done any of these, you get a score of 0. Next domain is your research publications. So you'll score the highest if you are the first author or the joint first author of 2 or more PubMed cited original research publications, or these could be in press, and you'll score 7 for this. If you are a co-author of 2 or more PubMed cited original research publications, you get a score of 6. This table shows the other scores for your publications, and this will depend on whether you are the first author or the joint first author, or you're not one of the first authors for the publications, and how many PubMed cited original research publications you have. The last domain is leadership and management. To score the highest in this domain, you must have held a national leadership or managerial role related to provision of healthcare, or in a non-medical voluntary capacity for 6 months or longer. If you have held such a role at a national level, then you get a score of 8. If you have held such a role at a regional level, you get a score of 6. If you have held such a role at a local level, then you get a score of 4. And if you have never held such a role, then you get a score of 0. All the scores in different domains will be combined to reach a final score for your application, and this final score will be the basis of whether you are shortlisted and whether you're called for interviews. And once you're successful in these interviews, you will be offered a core surgical training post, which lasts for 2 years, and then you can go for higher training to become a consultant in a surgical specialty in the UK. So that was all about core surgical training applications. If you like this video, you can click on the like button, share this video, and you can subscribe to this channel. If you have any other queries, you can post your queries in the comment section of this video, or you can message me on Instagram and I'll try to answer all your questions there. So hope you liked this video, and I'll see you soon in another video. Thanks for watching.